is organised. Thanks for that, Victoria. So this meeting is organised by Partnerships for Social Justice, which was set up by Ghazala Mir from the University of Leeds, and Ghazala's with us today. And this brings together a number of different networks that are working on various aspects of inequality, seeking to understand and tackle the processes that lead to discrimination, exclusion, and inequitable access, particularly around public services. So this is the fourth in a series of workshops that we've held, and the others have focused on leadership, also understandings of inequalities amongst the public and professionals, and pathways towards greater equity in public services. So today our focus is shifting somewhat to look at various ways of engaging and empowering the public, clients, patients, and so on, to be part of transformation processes. And we're really delighted that we've got 4 really excellent talks for you this morning. It's a packed agenda, so what we would ask is that you use the chat to pose your questions to the speakers, and I'll bring you in if I can, if we have the time, and if not, I'll pose those questions for you. We've organised it so that after the coffee break we go into small groups, and we found in the past that that's really a good way to ensure that everybody can have good discussion and debate. So the intention of the workshop really is that there's a sort of dual aims of this. Some people will be joining for the first time. You won't have been to previous workshops, and that's fine. You're very welcome. Other people have been to previous ones, and there's a sense of an ongoing dialogue and discussion, and indeed some collaborative projects are emerging from these workshops. But at the same time, we hope it's a useful space to debate, discuss, share your ideas, and hopefully take something useful away to your own work. So without further ado, I would like to invite our first speaker, and this is Leila Kogbara, who is the director of Black Thrive Global, and she's going to talk to us about improving employment outcomes for Black people with long-term health conditions. Over to you.
Hi, everybody. I'm Leila, as Sarah has said. I hope you can see the screen. Is that all clear? I'll shout if it's not, but I'm hoping you can see the screen.
It's good.
Good, thank you. So yes, so I'm going to talk about, I'm a director of Black Thrive Global, which we've relatively recently set up as a community interest company. But the work I'm talking about is actually Black Thrive Lambeth, which is the origins of Black Thrive Global that I'm going to talk about today. So first, a little bit about Black Thrive. So Black Thrive is actually a partnership, which includes the local authority, health services, police, and community partners. And our purpose is to address the inequalities that impact on Black mental health and wellbeing in Lambeth. That's the purpose of the Lambeth organisation. And actually our origins were from the death of Sean Rigg by being restrained while a musician with a mental health diagnosis who got restrained. So that's what happened a number of years ago, but that's what's taken time to set up Black Thrive. And we facilitate action-based collaborative working. And one of our core principles is sharing power between communities with lived experience and services, Black communities with lived experience and services. And we use the collective impact model, which was devised by Kanya and Kramer in 2011. The project that one of the projects that we're working on, one of our initiatives, is looking at health and employment for Black people in Lambeth. And that is based on the number of statistics which we all know, that disproportionate number of Black people who live with long-term health and physical and mental health conditions. And for example, in Lambeth, Black people tend to acquire long-term conditions earlier, up to 10 years earlier. And there's a significantly higher proportion that have double the number of people in the proportion in the population that have these conditions relative to their numbers. So, and then the other issue, again, generally well known, is that Black people are less likely to be in employment more likely to be in low paid and insecure work, and more likely to face discrimination in the workplace, more likely to raise a complaint or grievance, and more likely to be disciplined or dismissed. So what we find is that there's a cycle of, a negative cycle that is set up from this interaction between health and employment. So there's good evidence that says that employment is good, good work, good employment is good for health, bad employment isn't. And that, but there's this cycle that means that poor health can often lead to not having a job, which then leads to financial problems, anxiety, depression, worse health, and so on. So that's the cycle that we're looking into and trying to break. This diagram here is by Canyon Kramer, published by FSG a couple of years ago. The water of systems change is something we use as a way of thinking about what are the systems in operation that we want to change. And also, so when working with the community, we try to be quite explicit about what the issues are. And from my personal experience, I find that mental models, i.e. the whole thought process is what people think and how they look at things, what the narrative is obviously the underpinning for everything else. And from my experiences previously, having been an accountant responsible for resources, I found that in that role, I made more impact on equalities than I did when I had a job that was about equalities. So I would say the other thing for me about what you try to shift is resource flows, but that's not always easy. I found that relationships, power dynamics, and practices have also been key in terms of working with the community. Policies, hardly any impact. And yet, with a lot of community work, people are driven into looking a lot of policies without really trying to shift everything else. So what are we doing? We've been funded. We got some money from Guy's and St Thomas's charity to run this employment project, to try and increase the number of Black people with long-term health conditions who are employment through looking at systems change. The key elements of this project are a radical and flexible funder in GSTC. They are brilliant, and radical and flexible partners. So people who we're working alongside who are working in a action learning spirit has been important. We've got a lived experience team within the Black Thrive. We've got a working group of Black people predominantly with lived experience of mental or physical health. And we've got community peer researchers community and peer researchers who've all got lived experience. So basically, one of the things we've learned already is that hire the people. So that it's not a bunch of people with no lived experience trying to engage with lived experience, that actually having people who are hired and paid, who have got lived experience is actually quite significant. The other thing that we've got as part of this project is a £300,000 funding pot, which the community has total power over. So they decide, that community group decide what the money is to be spent on. Trialing system change, fixing things, new types of services, connecting dots between services. And we're hoping, COVID permitting, to do a participatory budgeting exercise on an estate. And I've just come this morning from doing an interview with some of the people we're allocated with the first tranche of money. Our first tranche we're giving out is 122,000 to 8 organisations. And it is absolutely inspiring to find the number of Black-led, disabled-led organisations that have come forward to just say, this is what I've been trying to do. And it's amazing and it's inspiring, but it's also quite emotionally challenging, because it's like, why haven't people been supported in this way all along? And then the other key aspect of our budget, we're doing the research as well in terms of what people want, what people need, but we're also doing a developmental evaluation approach, which is led by our community and our peer researchers with lived experience. And we evaluate, learn and adapt as we go along. So I say guide by the side, not judge at the end, meaning that, you know, we we don't wait till we get to the end and then we find that we haven't done wasn't as it should have been, but actually finding out what doesn't work and what works. And so one of the issues we found recently is that the community working group needs to change the way it works, change the emphasis on the type of conversations that we're having, for example, and we're in the process of making those changes. The other thing that we've learned along the way and we're now implementing is the need to engage with the powerful parts of the system and to bring the community voice into that, so that we don't want to be a sideshow, that if you want to change the system, that you need to engage with the system and the people with the money and the power. So we're trying to influence the mental models. We're trying to talk through the fact that people have got legal responsibilities, many of which are ignored. So most people are not compliant with the Equality Act in relation to race or disability. There are a number of policy levers. Organisations say we want to do employment, we want an inclusive economy, we've got social value in our procurement. And so we present ourselves and the community as we can help you do the things you say you want to do. And then the other thing that we're focusing on is high leverage activity. And data collection is one, actually. People often underestimate that data collection is a leverage in itself, and the analysis. And part of having the community doing this work is that what we take away from the analysis is different. Our understanding is through a different lens. And we're focusing on things like the community getting involved in looking at things like occupational health, reasonable adjustments that can be funded by access to work, contractual requirements, so supporting the council to include quite very clear and specific things in its contracts. The CPA care program approach, we've just started trying to look at what happens, what is in the documentation, how come people who are on a CPA don't get the opportunity to be involved in looking for work. And the thing I would say from a community perspective, of which I'm one, I volunteer for Black Thrive Lambeth actually, so I don't get paid for anything I do there, and that's what I spend most of my time doing. But opportunities do come in many forms, but they certainly come dressed in working clothes. Basically, if this is not easy work, but it's not that hard either, to be fair, and that work is what you do in our minds as well. So the mental work is as significant as anything else. So that's it from me, keeping to my time. It's a quick run through, but I hope that gave you a flavour of what we're doing. And yeah.
Thank you. That was really excellent. And although it was short, you packed in a lot of really important points there, and a lot of kind of connections going off in my head. I think everybody's just warming up this morning, so I'm waiting for my assistants to put questions from the floor. People can raise a hand if they wish to. I need to just get myself in a situation where I can see the raising of hands. I hope this will work. But can I start first? A lot of people are just thank you for the talk and saying how great it was. I would just like to ask, so I really liked the model where you had I think it was a funnel, and you had different sort of points of potential action to shift the system. And you highlighted the fact that policies, and that just rang so true. Later speaker Amy, who's coming on, I'm sure will also agree, because we're doing some work in Pakistan where this is so true. So policies don't necessarily go anywhere. I guess this might be a bit contentious, but do you think that that's intentional? Is it intentional displacement activity, or do the people developing these policies actually have good intentions but aren't really aware of the fact that those aren't the key things, and it is more about framing and shifting people's understandings, and, as you said, actually getting resource in the right place?
I think it's a mixture of both. I think that some parts of the statutory system in particular have good intentions but don't really understand, and that's why I think that diagram is quite good at getting people's minds around the whole thing. Some people fixate on policies not on purpose but because they just that's what they have in mind. But I think there's also a lot of, with the NHS, local authorities, etc., and I've worked for both the NHS and local authorities, boxing people into a space where they can't actually influence. So I can get you talking about a policy for months and months, engaging you in all of that, and then you wonder, why doesn't anything change? And I think that there are enough people who are clever enough to know that by boxing community engagement into that end, you never have to. You don't ask them the question like, is the basis and the premise of our whole thing right in the first place? You know, they sometimes ask those little questions, but very rarely do they open up to challenge the very mental models and mindsets and presumptions that are at play. And for Black people, certainly, and for disabled people, that is one of the key planks of inequality, and the absence of research in some of those areas as well.
Okay, great. Thank you for that. We've got a comment which is kind of leading on from that. This is sort of saying that, you know, what will determine your practice is if you don't have a policy. So I'm not sure we're saying we don't want policies at all. I don't know if you want to come back on that.
I'm not saying we don't want policies. What I'm trying to say is that the policy, focusing on the policy without addressing the other stuff doesn't work, is basically what I'm saying. So if you're looking to what to change, good policy will come out of having thought through a lot of the other things.
Perfect. Thanks, Leila. We're going to have to finish there for this, but I think a lot of these issues are going to, you know, we'll see them recurring, I think. So let's go over now to Ollie. Ollie Newton is Executive Director of the Edge Foundation, and he's going to talk more about young people and engaging young people in policy change, particularly around education, I think. Okay.
Wonderful. Thank you so much for that introduction. So yeah, absolutely. I want to talk about how we might do more to involve young people in developing education policy, both at a national level, but also at a local level and in their institutions. I spent 12 years in the UK civil service in the Department for Education, doing policy development work. So I'll talk a little bit about that. I escaped about 4 years ago, and I now run a charity called the Edge Foundation. We're focused all around trying to make education more relevant. So this is really important to us. But I also just wanted to acknowledge a debt to a partner charity called Phoenix Education, who specialise in youth voice work. And I've really been working with them on what I wanted to say today, because this is an area that they specialise in too. So I wanted to start by just drawing attention to the fact that these questions are about kind of a basic human right, and they relate really closely to Article 12 of the UN Convention. So that says that in respect of the views of the children, every child has the right to express their views, feelings and wishes in all matters affecting them, and to have their views considered and taken seriously. And the reason I wanted to mention that was one of the amazing young changemakers that we work with, Aaliyah York, who founded an organization called Pupil Power at the age of 16, and I'll put a link to that in the chat at the end. She recently took the UK government to court, to judicial review, because she put a question in as part of the coronavirus briefings that happened every day, where members of the public could ask questions, and she was told that they wouldn't accept questions from under 18s. So she took it upon herself to raise the money through a crowdfunder to take the government to court based on not adhering to that article of the UN Convention. So important stuff, and also a real kind of important lever for young change makers who want to use it. I wanted to touch on kind of 4 key points today about how we might make a reality of young people's voice in education policy making. And the first of those, which may relate to what others have to say for different groups, it is about avoiding tokenism. I think it's worse to include young people's voice in a tokenistic way and kind of give a false impression that they have influence. Sadly, I saw examples of this when I was doing policy making in government, where ministers had really made a decision already about the policy that they wanted to introduce, but they wanted a group of young people to come together quickly to either give it kind of extra oomph or kind of be able to say that they'd consulted young people. That I think is worse than kind of not consulting at all. I think on the kind of flip side, we've seen some great examples in the opposite direction. Often it can be better to start locally. So there's some wonderful work being done in Greater Manchester specifically at the moment, through the work that Andy Burnham, the mayor there, is leading to get much greater youth voice, particularly in support around the coronavirus and kind of post-corona support for young people. One of our partner charities as well, I just wanted to mention Youth Employment UK, which campaigns for better support for young people who are unemployed or facing employment difficulties. They have a wonderful model where they actually have a youth board who hold their chief executive to account. And I can tell you for free that she's a lot more scared of the youth board than she is of her kind of official trustees for kind of charity commission purposes. They're the ones that she always has in mind, that she needs to keep happy, that she needs to make sure that the organisation is delivering for. So for our discussions later on, and I'm looking forward to joining you for those, one thing you might like to think about in this area is, what real spaces for young people are there to influence education policy? What should they look like? Is it reasonable to kind of expect that at a national level in a meaningful way? Is it better to focus our attention on a local level, building on the kind of example that I mentioned from Manchester, or even at a more local level in terms of decision making within individual schools and colleges? What might those spaces look like? The second area I wanted to touch on was about the culture of those spaces once we have them. So once that question of tokenism and meaningful influence has been answered honestly, then I guess the next consideration is really about what culture do we need within those spaces to establish them in a way that means that young people's voices are respected, taken really seriously, and they feel like they're kind of peers in that discussion. I'm part of a leadership group for taking forward kind of change-making education within the UK, and we have 2 young people on that as what we call co-leaders, and it's been really valuable to have that experience and to see not kind of a youth board separated out or a youth reference group, but actually just equal board members who happen to be young people. It's really kind of made the culture of that group incredibly positive, and definitely something that I'll be continuing to use in different areas of our work. Perhaps the best example I've seen of this is actually from some work that we've done in the creative education space. So thinking about education in performing arts, in drama, in art. We had a big summit where we brought together people, from all kinds of different backgrounds, from really experienced educators down to, year 9, year 10 pupils. And the kind of the way we engaged them was again very much as peers. There were young people and adults leading sessions and being part of sessions, and it was just really refreshing and beautiful to walk around the theatre which we were holding the session in that day, and see kind of that mix and everyone's voices being heard equally. But I think it took quite a lot of setting up, not just in terms of the kind of ground rules, but also the kind of physical space to ensure that that was possible. So I think on that kind of topic of space, I think for our discussions later on, one area you might like to think about is, how do we create that culture and space for young people to help them to really feel respected in those discussions, to be taken seriously, and I guess also to feel safe enough to share honest experiences and not just kind of the things we might want to hear as adults or as policymakers. So I think the third area that I wanted to touch on is just around, which voices are heard in those spaces. Once we've got those genuine, meaningful opportunities for influence, once we've identified or created them, once we've tried to set the culture of those spaces so that there's an opportunity really for authentic and open sharing, and for young people to be equal partners and to take the lead in those discussions, who have we got in the room? And I think I'm sure this is a theme that will be echoed by other speakers as well, but different young people interact with the existing system in different ways, depending on all kinds of elements of their background. They'll have very different and unique individual experiences, and it's really important that we don't kind of second guess those or assume that one young person speaks for a particular group. So I think that element of diversity, but also kind of personalization, is really, really important in those discussions. And it's important that we have a wide variety of young people with different lived experiences as part of those discussions. So again, for the conversations later on, as we kind of get into more detail on this, I would definitely invite you to think about, how do we ensure all young people's voices are heard through that kind of spectrum of experience within the system, and how they found, how they listened to, how are they taken seriously. So I guess the area that I wanted to come on to fourth, and this is an area that's really dear to our hearts at the Edge Foundation, is just thinking about, for young people's engagement in this process to be really full and really meaningful. It's really important for us to think about not just kind of the informal spaces, but what are they learning or not learning in the education system itself at the moment, about their rights, and also about the skills that they might need to really present their evidence, their lived experience in a way that kind of does them the most justice and helps to kind of take forward the discussion. I think it's no accident that I think the most watched TED talk in the world was by Sir Ken Robinson, who sadly passed away this year, about how the current education system is built on centuries of trying to create subservient subjects. That was the kind of aim of having, all those desks facing the front, the panopticon principle, everyone doing the same thing, silence in the corridors, no running, follow the rules. There are still schools that are being lauded by the current, education minister, which focus on exactly those kind of 19th century principles. But I don't think that those are the kind of schools and the kind of regimes that are kind of helping young people to be free thinking, to put their own points of view, to be confident enough to share their lived experience in a discussion with others and with adults. But I'm happy to say that's not how all schools and colleges work. And we've had the privilege of meeting and being part of spreading some really amazing models from around the world. So I wanted to share just a couple of those with you. We do some great work with a school, or a set of schools rather, called High Tech High, which is based out in San Diego. And they have been pioneering for years now the idea of a much more expansive education, and particularly focusing around project-based learning that brings different subjects together and helps young people to make a real difference in the outside world, and use that experience as part of their learning. I was talking to one of the teachers there a couple of weeks ago, obviously with the very topical issue of the American election, and they'd done this amazing project where they took kindergarten kids out, and they told them that it wasn't always the case that everyone had a right to vote. And obviously with that wonderful kind of wide-eyed element of young children, they were like, no way, that's incredible, like completely mind blown. How could that possibly be, ready to, take up arms to kind of fight for freedom. So teaching them about that, teaching them about what it means to have the right to vote. And then they actually went out into the local university, the college there, campuses, and were working with a local charity to register people to vote and tell them why it was really important to vote. So just one little insight into a way that actually they were learning there about history, they were learning about the development of communication skills, of talking to different people of different generations, but they were also out there making a difference in that case in terms of making a really important point about how important it is to vote. Over here in the UK, one of the groups of schools that we work with is based near me in Sheffield, but over in Doncaster. It's a school called XP, and they do some amazing work building on the kind of models that I've mentioned from XP. It's an incredible school. You should definitely take the opportunity to visit if you possibly can, and I'll share a link to their work in the chat as well. But I wanted to mention one particular piece of work that they did recently. It's a film, it's on YouTube, and I'll share the link, but it's called Should I Stay or Should I Go? And this was a project that the students did with the immigrant community within Doncaster to really understand their stories, to get to know them through a local conversation club, and to use that as the jumping off point to start talking about global issues, politics, history. So again, not moving completely away from kind of having the curriculum, getting that knowledge, but doing it in a way that built their skills, but also built their characteristics of empathy and understanding. And that project ended in a film that they made about the lives of those families, but also in a fundraising project that they led to buy bikes and books for those families to make sure that they could get to jobs and college. So a real kind of testament to the kind of work that the kids put in, but also the kind of values that they developed through that. We're really keen to kind of expand that take on education and to make sure that it's not just about sitting at those desks, looking at the front, learning rote knowledge. It's much more about helping young people to build those skills that they're going to need to express themselves, and also to challenge views and to kind of make a point about their own experience. We're just starting to work with a charity called Ashoka, which some of you may have come across, which is a global charity focused on helping young people to develop what they call change maker skills, all the things we've just been talking about around empathy, around community support, around problem solving. So we're going to be working in Greater Manchester to start with, and then broadening that out across the UK, trying to support schools, colleges, universities to integrate more of that thinking, more of that breadth, more of that character development into schools, so that we can support a much wider range of young people to take an active part in helping to decide their futures. So for our discussion later on that element, I really wanted to invite you to think about, how do we need to change the education system to create a generation of young people who are questioning, who are thought leaders, who are able to express themselves and to challenge things that they see as unfair. So yeah, I'll finish there. And as I say, when we've had a few Q&As, I'll just spend some time popping some links into the chat to send you to our colleagues at Pupil Power, the organisation that was started by Aaliyah, to Ashoka that I've just mentioned, and to Phoenix Education, whose support I'm grateful for their thoughts on this issue.
Okay, thanks, Ollie. That was really interesting and very well kept time as well. Lots for us to take in. I was trying to take some notes as well. We've got one or two people who are asking some questions here. Some of them are kind of quite bigger questions and some of them are smaller questions. I'm going to hopefully invite Claire Norman to come in. I think there's an issue here around sort of actually the processes of involving people. Claire, do you want to speak? Are you happy to speak just to get a bit of interaction?
Yeah, that's fine. Yes, thanks, Ollie. That was really interesting. I suppose I'm just wondering, I think it sounds like a really good idea to get people involved, but I just was wondering how do you actually recruit people from these backgrounds, and how do you make sure that it's not just the same kids who are always going to be putting themselves forward for these opportunities, and making sure it's a wider and accessible opportunity to get involved with?
Yeah, it's a really good question, Claire. So I think there's a range of techniques that are helpful. I think it's important to recognise that it is quite a kind of specialist thing. So we often work with partners in other charities that specialise in youth work and in detached youth work, who are kind of working with these young people. I think secondly, it's really important to kind of have that emphasis on place. So often when I was in the kind of national policy role, ministers wanted to know what young people across England thought, and obviously that's kind of a redundant question. You have to kind of think of people in a particular community and what they think. So taking that kind of geographical element, I think, is really important. And recently, I think we've been relying much more heavily on young people recruiting young people. So I mentioned the kind of couple of young people we've got on the board that we're using to run the piece of work in Greater Manchester, and we're relying very heavily on them building that community of young people. So it's not kind of it changes the dynamic, I suppose, when a peer is asking other young people for their views. I think that can be a much kind of freer conversation than necessarily like an adult coming to seek the views of young people. So I think that's kind of another technique that I think can really help to reach out into a wider community of young people.
Okay, so with the Greater Manchester one, were all schools kind of offered the opportunity for people to get involved, or?
Yeah, exactly. So we're going through networks of schools, but also through networks outside school, because not everyone wants to engage in that way. So through kind of voluntary sector organisations that support youth work in Manchester, through youth clubs, through Scouts, so through kind of as many channels as possible, I suppose, to try and make it as open and equal a process as possible.
Okay, thanks, Claire. I just want to move to something slightly different now. Obviously, all the issues are somewhat connected, but a couple of people on the chat have raised the issue around how can schools kind of do this more radical work while still sort of maintaining their, fitting within the established curriculum, and concerns about Ofsted and all the rest of it. So all these sort of top-down structures that might cramp their style or get in the way of doing this creative thing, these creative activities.
Yeah, that's a very, very well put, Sarah. So what I think is important to say is we're absolutely not saying that kind of knowledge goes out the window. Knowledge is still really important, but I think it's now not the case that education should just be about kind of rote learning and recalling the kings and queens of England. We need to kind of go beyond that. So it's about getting the balance between knowledge, skills, and kind of behaviours or ways of being. It is absolutely possible to do that within the existing framework. So I guess what we're pushing for is kind of a twin track approach, kind of schools and colleges to use the freedoms that they already have, which many are not using in full, to start to do as much of this as possible now. So the schools I mentioned, like XP in Doncaster, like School 21 that we work with in London, these are all state schools working within the existing framework. They are teaching in this broader way, and actually getting very good GCSE results because their young people are really engaged in the curriculum, really keen, kind of self-directed learners. But they are recognizing that GCSEs and rote learning are not the be all and end all. What they want is rounded young people at the end of that. It's just they're also doing that. At the same time, the kind of other track of our approach is that we really think we need to change the way that the education system works to mean that this isn't pushing against the grain. And in fact, the education system and education policy is kind of coming in behind this. And we're doing that through kind of a range of policy influencing. But in particular, I wanted to highlight some work we've done recently with a new organisation or a new movement we founded called Rethinking Assessment. And again, I'll put the link in the chat. But this is a group of head teachers, multi-academy trust leaders, college principals, academics who are all keen for us to think about a broader way of assessing young people, because that drives so much of the behaviour. So we're looking at options along the lines of things like the International Baccalaureate, but also broader examples from other places like the Mastery transcript from the US that start to recognise a much broader range of young people's abilities at the end of their education. And I think if we could do that, and if we could recognise that, then the education system would be likely to kind of fall in step and start to be pushing to produce that, rather than seeing this as potentially a distraction.
Yeah, that's really interesting. And then presumably that would then also have a knock-on effect to the types of things Ofsted or whatever would be looking for in a good school or an excellent school. It's interesting that Layla on the chat's also made some connections there with other kind of structures of quality control. So she's saying CQC and other bodies focus too much on, you know, their sort of narrow performance indicators, and maybe, you know, miss out on other things that are much more important. So that's really interesting. I'm just going to put the question from Andy Divers to you myself for the because of time, because then I also after that hopefully want to bring in oh, I've lost it now. I'll find that in a minute. But oh yes, so Dawn Hodgson, if you don't mind being ready to come in a minute, who's got an interesting other example from Iceland that she wanted to just mention. But Andy Diver says, I feel like I'm on a radio show. Andy Diver says, when trying to engage with young people, how far do you think we need to completely rethink the language that we use? So he's worrying about things like words like thought leaders may intellectualize the issues. So thinking, yeah, a lot about framing and language. Can you come back on that?
Yeah, of course. I think you've definitely got a future in breakfast radio, Sarah. So that could be a side career. Andy, that's a really important point, and I think it's really important to kind of take young people's views on this and try and get the balance right. On the one hand, I think, and I saw this again when I was working in government, there's a temptation to go too far and for it to come across as patronising to young people if we kind of attempted to change the language completely. On the other hand, you're absolutely right. Young people are great at calling out like management terms that we slip into and acronyms and, you know, things that are meaningless that come up again and again in the kind of education discourse. So I would kind of always just kind of go back to kind of listening to young people, using them as the kind of best barometer when thinking about that. I don't think it's a complete change of our language, but I think it's actually a really helpful kind of wake up call / reality check on some of the language that we use to say, is that really a meaningful term? And if so, can you explain it?
Thank you, Ollie. Okay, Dawn, would you like to just come in and very briefly, just in 1 minute, just let us all know about this model from Iceland that you say that is interesting? If you're there, I hope I'm not putting you on the spot too much.
No. What it was, I was looking up to visit Iceland, and I was actually interested in the crime rates because I'd spent the previous year in Dubai, and both of them were claiming to have zero crime rate, basically. And when we sort of dug a little bit deeper into this, what they said was all the children in Iceland from a very young age were involved in sort of community practice as part of their schoolwork. And it gave them the sense of being part of things. They worked in old people's homes, they did gardens. It was really wide ranging. And I was just wondering if you looked at that at all, Ollie, because it was just such an interesting kind of approach to education. It was just, had you seen about, you know, had you looked at Iceland? That's so
helpful, Dawn. Yeah, no, really, really helpful. We've done quite a lot of looking at what's broadly termed in the literature service learning, but I hadn't come across that example, so it's really helpful to know about that. I'll certainly have a look, and yeah, I hope maybe I could even go and visit the volcanoes of Iceland and find out a bit more about it. Thanks for the tip,
Dawn. Good move. Thank you.
Great, thanks, Dawn. I think there's also some, you know, really useful to make those connections, because actually there might be some things that are useful for Layla's work, and also perhaps for the sort of things that Jason's doing as well. So I'm going to invite Jason to come now. Jason, if you could get your slides queued up, that would be great. And Jason is currently working as a lived experience researcher with the Synergy Collaborative, and looking at serious mental ill health and storytelling as the tool.
Yeah, hi. Thanks for inviting me to kind of speak to you lot today, Sarah. Also, thanks to Vicky and Victoria. Okay, so yeah, I'm going to be talking about biographical storytelling to understand ethnic inequalities in severe mental illness. So yeah, that's the kind of title of the talk today. I'm a lived experience researcher, and essentially we've talked a lot about lived experience today. So I kind of just thought I'd give a little snapshot of how I describe my own personal lived experience. So left, we're starting off with Empire Windrush. I'm sure many people on the call will know about the Windrush situation, especially with the recent scandal. But my grandparents came from St. Lucia, so they obviously came to, the UK seeking a better life. And like many kind of Caribbean people of their time, my grandfather worked as a bus conductor for the London buses. And my grandmother, unfortunately, was unable to work. We always said that she was a bit homesick. But I think looking back now, I recognize she probably had an undiagnosed mental health condition. Moving on to the next image. So this is an image from the New Cross massacre, so the police cover up. So about 17 or 18 young Black people were killed in a house fire in New Cross. And obviously, nobody was ever convicted for that crime. And I grew up in New Cross. So New Cross is the area that I grew up in, so Southeast London. And it's one of those areas that most people have never heard of, but it's recognized for those two incidents. So the one incident is the New Cross fire. The second thing we're mainly known for is our local team is Millwall. And obviously, if you're a football fan, you know all about lovely Millwall supporters. But yeah, so New Cross is one of those places that is very, very diverse, but also has a long-standing history of different, topical social issues that have happened. Moving on to that, so that was the 80s, I should say. So that was when I was born, giving away my age. Moving on to the 90s, we have Stephen Lawrence. So again, most people will probably, I hope most people know who Stephen Lawrence is, but he was a person who was murdered in Eltham, again, Southeast London, about 4 miles from where I grew up in New Cross. And that murder had a real detrimental impact on me as a young Black boy growing up in Southeast London. So it meant that I was, I suppose, fearful for my life, actually. So I think he got killed when I was about 13 years old. And that is kind of, so when people talk about, why do young Black men hang around in gangs, or why they're involved in violence, you recognize some of the fear that people are living under, actually. So fast forward, obviously, I kind of, jumped a few years. We've got down in the bottom left, we've got Mark Duggan was killed. So, and this was a kind of really pivotal moment in my kind of life journey, I guess. So when he got killed and they had obviously the riots happening all over the country, I was like, well, something needs to be done here to try and help, young, not just Black boys, but young people in general who are caught up in gangs and crime and violence, to try and get them to kind of see another way of doing things. So I went to work in prisons. So I was working in prisons for 5 years, all across the country, up in the north as well, was in Home House, as far as Wales as well, we're in South Wales. So I was working in prisons for about 5 years. And then I kind of fell into psychosis. So when I mean fell into psychosis, I had 3 separate psychotic episodes before I even knew what mental health was, and I kind of fell into the system. So that's kind of like a broad overview of where I'm coming from. So to talk about Synergy, so Synergy is a collaborative centre. It's a 5-year national initiative funded by Lankelly Chase. And the idea was to reframe, rethink, and transform the realities of inequalities in severe mental illness and multiple disadvantage. So similar to what Layla was talking about, we're taking a collaborative approach. The centre aims to use the principle of co-production of knowledge and creative mix of robust research methods. The centre, is basically trying to work with commissioners and policymakers and politicians, really address, these issues of people experiencing, severe mental distress, and to create and deliver a vision to help eradicate, especially the ethnic inequalities in severe mental illness and their fundamental causes. So one of the papers that have come out of our collaborative, researchers. So this is kind of like one of the leading papers from our professors. So James Nazru and Kamaldeep Buri and James Rhodes. But there's a paper looking at, we're next for understanding race and ethnic inequalities in severe mental illness, so structural, interpersonal, and institutional racism. And the headline quote for me really is just like, ethnic minority people in the UK are at a much greater risk of being diagnosed with, severe psychosis than British people. And this is particularly the case for Black Caribbean and people from Black African origins. And I think on a personal level, it just makes me think, so what happens to me is not unique to me personally experiencing psychosis. Actually, it's happening to a number of people across the country. So in terms of our methodology, I don't know if people are familiar with Tom Wengraf. So he has something called the Beanin methodology. So it stands for the Biographical Narrative Interpretive Method. So it's a qualitative method for exploring, the lived experience through biographical narrative interviews. It's been used for about the past 15 years and mainly used in collaborative research projects. And the way I describe the kind of methodology in kind of simple terms, like the first subsection is like 1 hour of free flow talking. So you essentially ask a participant one question and then you listen for up to an hour, just allowing them to speak and get all of their stress and turmoil off their chests. And basically you're trying to make note of key themes to draw on later. In subsection 2, we then, draw on these key things, but we ask them the questions in a particular way. So it's basically saying, okay, so you said, X, Y, Z. Could you tell me more details about that time? And the idea of the question is to get them to really focus in on the example that they want to share. And the last subsection is basically a 20 semi-structured interview questions where we pick up on themes like, identity, mental health services, community support, and racism. So to give you a kind of brief snapshot of some of the participants, I won't go into too much detail, but this to kind of give you the headline flavor. So one participant was a former child soldier from Angola. Now, again, obviously I vaguely remembered there was a war in Angola, but I didn't know the details. And this person really opened up about, what they experienced as a child, and it's absolutely horrendous what they went through. Obviously, they came to the UK to seek asylum, and luckily the UK gave them their asylum once they went through the process. But then they ended up on a large council estate in Manchester and experienced some of the worst abuse and racism that I've even heard about. And I know, because obviously in my story, people were openly racist in the 80s. And I think for my own self, I don't really experience that racism so much now. But to hear a participant describing the everyday racism they're experiencing today is absolutely heartbreaking. The second participant, they grew up on another massive council estate. And their thing was, so they live with a severe mental illness, but their thing was really wrapped up in their identity. So they were, gay. They're gay, but they can't be as outwardly open in their sexual identity as they would like to be. But they're also practicing Muslim as well, and obviously the tensions between religion and sexuality is really playing out in their mental health experience. And the last participant I wanted to touch on was, so this is another person from Pakistan originally, and obviously, again, if you know the history split, and so there's a lot of trauma from people from Pakistan actually. But again, came to the UK and then got referred to Prevent. Now again, we hear about Prevent and we hear about how it's helping to, weed out terrorists and kind of to change like people that are thinking. But they felt that they were referred unduly due to them mental health. They're an advocate and they try and advocate for other people living with severe illness who may get picked up by different parts of them unfairly. So this slide here is just to talk about, so we are kind of like an award-winning research team. So we won an award at the Division of Clinical Psychology, so the British Psychology Society's annual conference. This is before lockdown, so this is actually a real face-to-face conference. But and we won this poster presentation, and those are some of the research team, as you can see there. And yeah, so that's basically where I'm at really. So I'm happy to have any questions or any conversations as need be really.
Great. Thanks so much, Jason. Thank you for, in particular, sharing your own story as part of that. That's really interesting, and yeah, obviously that's a very generous thing that you've put into your presentation. There's a few things, questions coming through, and I'm just watching, but I think I'm just. Yeah, so the first one was for a little bit more clarity, I think, around, this is from K Andrews 3. Sorry, K Andrews 3, I don't know your first name. But basically just asking for a little bit more of an explanation around the way in which the existing environment and lived experience accounts for the scale of mental illness. So you touched on some of the structural aspects of discrimination and also traumatic biographies. I just wonder, can you give a little bit more? Perhaps this is for somebody who's not so familiar with the Caribbean and African experience.
Yeah, I mean, so firstly, what I would say is that obviously the Caribbean and African experience, especially for people like myself who are born in the UK, it is a British experience, right? And I think sometimes it's very easy for people who are not from Caribbean and African backgrounds to say, oh, it's something separate that's happening over there. No, this is a British experience. And actually, I think growing up in Southeast London, my original identity was about I'm a Londoner, right? But if you're a true Londoner from, you know, and obviously Southeast is the best side of London, I would say, right? But you recognise that it was a very violent, crime-ridden and stressful place. And usually it was because people were living with severe mental health experiences, not getting the treatment and help and support they needed. So obviously that had a real impact on the trauma that people were experiencing growing up in these areas. And obviously fast forward to today, I'm lucky that I don't experience that sort of trauma in my day-to-day life today. But you know, young people are still going through the same problems and issues that I was going through growing up in the 80s. And so as a society, we've got to get much better at saying, you know what, if these things are happening, yes, they're happening in our country, we need to do something about it. And we need to start leaning into these issues and making people feel comfortable with being really open about where they're coming from in order to get the help and support that is out there. But I think what I found, I suppose, most frustrating with mental health is that now I'm in the mental health system, right? So, you know, I've had a psychotic experience. I had 3 years of early intervention support, and I kind of manage my signs and my symptoms as I go forward. But what I recognize is that most, you know, most men, but Black men in particularly, do not get the same positive outcome that I've received. So I've been, for the past 5 years, talking to anybody that wants to listen to try and get them to understand how can we improve outcomes for people so they're not, you know, sharing or giving their trauma down to their kids and their grandkids, etc.
Okay, Jason, we've got a few more comments and questions coming in, which are more focused on. So the focus of today's session is very much around how we engage, how we empower, how we sort of bring the lived experience and the stories, you know, to bear on systems and on services. So a couple of comments and questions here from Caroline Mitchell, who's a GP and also works at the University of Sheffield. She's saying that, you know, the presentation was really resonated. So as a clinician, she hears a lot of accounts around people feeling very fearful and the impact of fear and trauma. She and also Adrian are both asking really how, you know, so you're doing this work to generate these insights and to get people to open up and to share their stories. How are you then mobilizing those or using those to co-produce solutions or to, you know, to engage with commissioners? Are you at that stage yet, or what are the plans for that?
Yes, yeah, so I think the synergy is obviously.
You've frozen, Jason. Oops. Let's hope he comes back in a second. Oh, that's disappointing. So I have a little bit of involvement with Synergy, but obviously not as much as Jason. And my understanding is that they are very much working with commissioners to create these sort of what they're calling creative spaces to allow dialogue and to bring this sort of testimony, if you like, and the lived experience narratives into those spaces. I'm not sure. I think that stage of the work is probably just getting underway now. Let's hope that Jason comes back and connects with us again in a minute, and we can come back to that perhaps after Amy's talk. I think we've got another couple of minutes to talk about Jason's presentation if anybody wanted to come in. Caroline, would you like to come in and say anything more whilst we wait for Jason to connect? Hi, Caroline.
I was going to pick up again. I was just writing about articulate advocacy, and I just think, you know, currently, despite having universal healthcare, it's absolutely critical to a positive outcome. No more so than in mental health, but actually in physical healthcare as well. And for anybody where that power dynamic is unequal, if people haven't got advocacy, in a pressured system, they will fall by the wayside. And I think those social partnerships, community action and stepping up to provide that advocacy is critical for individuals.
Yes. Oh, great. I can see Jason's back with us. Sorry, you got cut off. Put your microphone back on, Jason, and come in again with those. You're going to tell us more about the next stages, I think, that Synergy is going to be involved with.
Yeah, sure. So what I was saying is that, so over the summer, obviously in the aftermath of, Black Lives Matter, so Synergy has put out a pledge. And the idea is to try and get the whole system. So, mental health trusts, public bodies, commissioners, to really make a strong commitment to reducing the ethnic inequality in severe mental illness. I know in Manchester, just before lockdown, I know Andy Burnham got given X amount of millions of pounds to really transform the mental health system in Manchester. So I think Synergy is trying their hardest to work with the system to try and get things done. But I think COVID is either going to get the system to restart and move forward in a more positive way. And what I would say is in Sussex, we now have the Sussex Health and Care Partnership, where the whole system, so the CCG, the local authority, the NHS, universities, all the local charities are all working under one system. So you don't have this disjointed approach. And I suppose what I hope to see in places like Manchester is that you have that more joined up approach. No matter where you come in at the system, you're going to receive the same support and help and assistance that you would get regardless of where you're coming in at. So, and I think commissioners have to really make a strong commitment to not really accept this idea that if people have severe mental health issues like psychosis, that then they then can't participate in life and then they drop out from society and live in misery. It should be totally unacceptable for this to be happening, especially when we know that the majority, like they say, 1 in 4 people have mental health experiences. So we know that mental health is more common than we like to admit. And I think it's people like me that are very open about this, that this keeps on, trying to push this agenda forward, really. And I should say, it's not just me. I'm in a team of 5, all lived experience researchers, and the Manchester lot are more dynamic than I am, actually. So yeah, I'm one of the mild ones.
Great. So there was just a comment from Fatima Sadi, who was just asking whether we, when is racism and its impacts in terms of trauma, when is it going to be recognized as a precursor to mental ill health and as a diagnostic factor in itself? And I suppose I would add to that, so what you've just said there about the system level work, is racism, is that at the forefront of this? Are people really speaking openly and trying to, really address racism as a underlying cause?
Yeah, so I think most of the participants that I've spoken to have all talked about racism, and they talk about how they experience it. Obviously, racism is one of those contentious terms, because I don't know how I'm going to try and be as open as I can be, and I hope not to offend anyone. But a lot of white people don't like talking about racism because it makes them feel uncomfortable. And then for me, I never really understood this, because obviously there's this idea that, white people are only racist to black people. And obviously that's not true. Black people are just as racist, for Africans and Caribbeans. There's severe racism between, people from African descent and from Caribbean descent, right? So I think racism affects all societies. But I think the only time I really understood racism in a way for white people was when I used to live in Glasgow. Now, if you go to live in Glasgow, you have, the Catholics and the Protestants, right? So you have Celtic supporters and Rangers supporters. They're all white, but yet they hate each other with venom. Obviously, not all of them do, but there's a long-standing historical conflict between those two populations, right? And that's when I understood that racism is not a thing of black and white. We have to get better at saying, okay, why is it acceptable to hate somebody based on a protected characteristic or something they have no control over, right? I mean, that's not acceptable. And I think we're moving in the right direction. Obviously, there's always, I was listening to Barack Obama and David Olusogu yesterday on the BBC, right? And he's talking about, the stuff in America. So I think most of the time we do follow America's lead on some of these race issues. And I think we need to get into that situation where we are moving in the right direction. Like, most of my friends are multicultural, multi-diverse, coming from different backgrounds. And that's the way I like living in my little bubble, I guess, right? So as for me, when I was speaking to the participants, it was really painful to learn about what they're experiencing growing up in these areas. Because when I go to Manchester, obviously as a, coming up from the South, I don't experience that. Like, people say good morning to me, people say hello to me, people interact with me, right, when I'm walking around. But maybe people say, well, Jason, it's because you're friendly or whatever, right? But the reality is, everybody should be experiencing the same sort of warmth and love and care from the community and society more broadly.
Okay, Jason, thank you for that. I think that also connects a bit, doesn't it, to the example that Ollie gave us of working. I think it was the Doncaster School that was doing work to bring young people together across social and cultural divides, and to do that sort of engagement work, with different groups. So, I mean, as well as these, really nice examples we've had from you of people from minority backgrounds who've experienced racism, who's, you're encouraging and sort of, unearthing their stories to speak to those in powerful positions. Perhaps in the groups we can also talk about initiatives that are about bringing people across and, between communities as well. So that's really helpful. I think we need to stop now, Jason, because we've also got Amy waiting in the wings to give her presentation. So thanks. There's a lot of comments on the chat saying how helpful that presentation was. So thank you very much indeed. Amy, are you ready?
Yep, thanks, Sarah. I think Vicky was going to bring the slides up if she's still able to do that. That's fantastic. Super. Okay, thanks for having me. As Sarah said, I'm Amy. I live and work in Sheffield, which is where I am today. Although I grew up in Gravesend in Kent, which is not far down the Thames from where Jason was talking about in South East London. But I'm a lecturer in public health here at the University of Sheffield. So just to give you a bit of background, I do research and also teach on issues relating to participation and politics in public health policy in the UK and internationally. And I'm interested particularly in civil society or kind of community-led action and advocacy to address public health issues. So a lot of my recent work has involved working with community groups, residents, local authorities to help plan, understand or evaluate initiatives together, and trying as best as I can to work in ways that, Layla and Jason have mentioned about being, by people's side. So I'm going to be sharing some findings from a systematic evidence review on public participation and influence in local decision making, which was carried out as part of a project funded by the NIHR School for Public Health Research. And just to give you a bit of background, that's a partnership between 8 academic centres that work in public health in England. So the University of Sheffield is part of that. And for this project, I worked with people also at Cambridge, Liverpool and Lancaster. So Vicky's brought up this next slide, which is great. I'll just give you a bit of background of the research, putting it in context and saying very briefly what we did. Okay, so in terms of context, our starting point for the research was health inequity, so unfair differences in people's health status, and which obviously Jason and Layla have both kind of mentioned some examples of that in their talks, and with our understanding being that these stem from unequal conditions in which different people are born, where they live, where they relate to each other, work, age, and in the field of public health we often call these social determinants of health. So of relevance to the theme of the workshop today, there's growing public health evidence that one important condition or social determinant of health is exactly what we're talking about, having opportunities to influence decisions that shape our lives and decisions about where we live, and a recognition that these aren't equally available to people, and this leads to health inequity. So as a consequence, increasing participation and influence can be an important aim of strategies to address health inequity, or it's sometimes called health inequalities, and we see this in recommended WHO, World Health Organization policy in Europe, and the long-standing work of Sir Michael Marmot in the UK, if you're aware of his work. And in this vein, local governments, other organisations and communities themselves have kind of pioneered and experimented with various participatory initiatives for a long period of time, and we've obviously heard of some examples of that today. But more recently, these kinds of initiatives have been implemented during a difficult economic context. So we had the financial crisis in 2007 and 2008, austerity policies also that came in and have been associated with deep cuts in local government budgets. And they've also been experienced in the context of kind of wider social impacts of recession in many local communities. And of course, now we have COVID-19, which may well further constrain local resources, and there's concern that that will entrench inequities. So although there's been kind of experience with participatory initiatives, we actually don't know, particularly in the field of public health, how they really work to shape real influence and what that influence really means, and particularly when we're thinking about public health or determinants, and particularly when we're thinking about kind of the changing economic constraints. So if we could just go on to the next slide, that'd be great. So we carried out a systematic review on this topic, and for those of you who are unfamiliar with this term, a systematic review is essentially a clear and transparent and organised way of identifying and then kind of exploring evidence. You set out your clear parameters for what you want to look at, and then systematically try and do that. So we were focused on the research evidence that was published about participatory initiatives across Europe, so not just the UK, and specifically those that have been implemented since the financial crash in 2007, so that we could look at the role of a challenging economic context. And we only wanted to look at evidence about initiative whose purpose was real influence, if you like, in local decision making, rather than that kind of tokenism and consultation. We didn't want to look at that. Those were excluded, and we wanted to particularly look at initiatives that could affect where people live. So we were looking at kind of local, a local level, and this meant kind of towns, cities, neighbourhoods. So we weren't looking at national initiatives in any way. And we also looked at wider theory and frameworks about how changes in influence relevant to public health might come about, and had some informal discussions with various people living in and around South Yorkshire in particular. So residents, people living people working in the voluntary community sector, and people working in local authorities as well. So we tried to explore what the evidence said about effects, whether and how initiatives could lead to more influence, in what aspects of decision making, are we talking about here? Is this about those kind of mental models and the way that local issues are defined and prioritised? Is it about resource flows? Is it about community-led action and taking kind of decisions and acting themselves? Or is it about how statutory services are run? So we explored some of the factors also that shape what happens in practice, and tried to think about effects on various different living conditions. So because we did a systematic review, it's kind of like a synoptic approach, if you like, to try and look at lots of different initiatives. What I'm going to share in terms of findings will probably be a lot less rich in kind of detail than some of the other speakers, but I'm hoping that our findings still kind of resonate. And feel free to obviously comment on what I say and challenge some of the things, and hopefully you can let me know whether our findings kind of connect or don't with any of your own experiences. Okay, so if we could go to the next slide, that'd be great. Okay, so what we found out, well, firstly, carrying this out was actually really quite challenging. This is a really kind of complex topic, and there's always a possibility that we didn't identify everything that's out there about initiatives, and I'm pretty sure that we didn't. However, we still managed to pull together a range of different information about examples of specific participatory initiatives, and these focused on a range of different local decision topics. So they covered things like planning and the built environment, various aspects of urban regeneration, alcohol policy, and community capability building. And they were labelled in quite various and different ways. So we had things like area-based initiatives, engagement activities with young people, neighbourhood planning, social inclusion partnerships, participatory assessments and budgeting. They were also, some approaches were also called asset-based approaches and community organising. And what we'd actually planned to do was try and get a sense of the commonalities in some of these initiatives and develop a bit of a typology and to consider the effectiveness of each. But there was actually really I suppose in some senses quite little detail about what activities were actually part of each initiative, and actually even less about how they were intended to work to really enhance influence and shape people's living conditions and inequity. So yeah, I mean, in some senses there was actually quite little consideration about what influence actually means. What are we talking about influence over what? So if you could go to the next slide. So instead of developing a kind of topology of initiatives, what we actually did was try to pull out common elements that seem to be described as more effective. And this is my hand-drawn attempt to start to show some of this visually. So what we found was that more effective initiatives tended to involve a mix of different elements, and they're highlighted here in this kind of pink colour, and that they were implemented over an extended period of time. And actually reflecting just very briefly on you know, what other speakers have already said, I think there's kind of some real resonance with some of the things that have been highlighted already. So one of the elements that came up was developing spaces for participation and learning, and Ollie obviously mentioned this idea of spaces where people feel safe and can interact, for young people being really, really important. Another thing that came up was the importance of strengthening relationships, and this might be across different individuals and groups, but also relationships across professionals and the public. Then we also highlighted and identified, strengthening collective capacities for influencing, changing institutional cultures and practices to legitimise public knowledge, and finally what we've called here long-term commitments to public influence. So commitments that make involvement the norm rather than a one-off project. So this diagram is a kind of work in progress, and we're currently working with an illustrator to make it more clear and bring it to life. So if you've got any comments, you know, please do share them with me. I'm not going to have time to go through all of it probably in detail, but we can look at a couple of examples in a bit more of that. So if we take capacities for influencing, this is about capacities that individuals and also groups need to take part and influence decisions. And I think some of those have already been mentioned in some of the other talks. And here we found a range of capacities such as, you know, having confidence, having some sense of a collective identity and shared understandings, also having a sense of belonging, feeling part of that bigger picture, and forms of collective knowledge are all important in shaping who and how different people and groups can influence local decision making. And these capacities are affected by lots of other elements shown here, so like spaces for participation. And what we found was that formal spaces for interacting can be important, but as well as those very much more informal spaces, so things like community events, bumping spaces even on the street, community hubs, can all support the ways that people can be involved, because these are where people develop knowledge, where confidence can grow or indeed be undermined, and where relationships can also develop or indeed be fractured. And the evidence seems to suggest that having this mix of spaces is actually really important when we're thinking about inequity, because different people feel more or less safe expressing themselves in different types of space. So for some people, you know, an informal space might be really, really important. That's perhaps separate from a professional who comes in their suit and a particular way of talking and, you know, particular way of bringing their knowledge to the fore, but that might only be at particular moments of time. And we also found that those obviously formal spaces are absolutely crucial for accountability within decision making and for interacting with, say, local government officials, other governing authorities like housing associations, health agencies, all those being important. So I've just seen that I think someone's mentioned in the chat window something about the bricoleurs. So this relates to that idea of strengthening relationships. So bricoleurs were mentioned as a term, but I think also that the idea of kind of someone being a community connector, a facilitator, or a trusted local champion. We've also talked about advocates in some of the previous talks. That was highlighted as important, particularly for engaging people who might be socially isolated or marginalised in existing local contexts. So we've put facilitators, particularly where it is on the slide, because near to spaces and kind of relationships, because of their role in connecting people, connecting different types of knowledge, and connecting resources potentially, and changing the way that those resources flow, ideally in ways that can address inequities. And also their role in potentially kind of trying to shape those safe spaces where people are given permission to consider issues in particular ways, and where trusting relationships can hopefully grow and develop, and where learning happens. And finally, we've got this kind of changing institutional cultures and practices, and we really identified a number of organisational factors that can affect how initiatives work in practice. And one thing that came up was how participation can often be perceived as a cost, particularly in some local government settings, rather than as an opportunity. And so highlighted was the importance of kind of challenging views where that's the case. And then very practical things like inviting people to participate, listening, feeding back were all highlighted as significant. And while these sound, quite simple and perhaps a little bit trite, we all know that we should listen and respond. The kind of the theory, work that we looked at really provided a reminder as to why they're important, because of the way that they're experienced at a very human level. Being invited, listened to, and responded to, are important because they're experienced as a vote in confidence in someone's competencies. They show respect and can provide a sense that it's possible for someone to make a difference and be in control, and that can hopefully encourage further involvement, which over time could lead to influence. Okay, so I think we'll move on to the next slide there. I think there's probably lots of things that we can...
Amy,
yes?
I'm afraid you're out of time.
Oh, out of time. That's super. No worries.
Could you just give us your final kind of
final kind of summing up? Yeah, that's fine. I mean, overall, I think what came out was that those kind of core elements that I've covered were the core things that we really found that we wanted to convey on, and also that understanding that these kinds of initiatives are really about politics and power. And I know that's obviously been mentioned by a number of different speakers already today, and that we need to think much more about how that works and work through the process of how what we're doing, whoever we are, whether we're in a kind of local authority setting, me in a university, or if I'm if I'm a resident working to try and have an influence and change things, work through what do we mean by influence, what is it that we want to achieve, and how is what some of the kind of little small things that you even do on an everyday basis, how does that try to shift those kinds of power relationships that exist.
Okay. Thank you very much indeed, Amy, for an excellent talk. And people have been very complimentary about your diagrams and your pictures. They're all a bit jealous at your drawing skills. I'm just going to. We haven't got a lot of questions come in, more comments, and I think people are probably desperate for their cup of tea or coffee.
Yeah, absolutely.
So I'm just going to just highlight a couple of connections that have been made. So Leila, our first speaker, is saying that the legitimizing of public knowledge would make such a difference to evidence bases, and that resonates with what you were saying there. And I think there are also a lot of connections, aren't there? It's quite nice to see that when you've done a systematic review, so you've tried to reach out, that is really sort of resonating and confirming some of the more sort of in-depth experiences that we had from Leila, Jason, and Ollie, who've all obviously been very much kind of at the practice level. So Amy, I'm going to thank you for that, and hopefully in the small group people can follow up, and we're going to share the diagrams, slides and everything, so people may well find those useful to reflect on. I'm going to now ask Ghazala to come on. She's going to quickly give us a bit of an update on what's happened so far with Partnerships for Social Justice, and also just remind us of how the breakouts are going to work.
All right, thank you. Yeah, and I'm very conscious that I'm standing between people and their coffee. So, but I think it is important for us to just think about how we've used these workshops before, and this is a series of workshops. So, thinking about how we want to build on what's happened previously. So I'll just put up a few slides to kind of help get that across. And let's see. Can you see that? Okay. Oh, hang on. Maybe not as a slideshow. Okay, so just to reiterate that we're 4 equity-focused networks that have come together, and the idea of the collaboration of these 4 networks, which bring together policymakers, practitioners, community organisations and academics, is really to think about how we can collaborate to explore how to reduce the kind of inequities that people have been talking about this morning. And the workshops have been a way to for people to think about these issues, to learn about the evidence on how to address them, but also to think about new partnerships and future research. How can we achieve organisational change and reduce inequities in public services through the work that we might do together in the future, as well as spreading the knowledge that we have already. So from previous workshops, we've identified from the discussions 7 key themes that people have said are really important in terms of taking work forward through research. And most of these have been mentioned. So restructuring public services, improving the representation of who is actually delivering these services, who is making decisions, how ready organisations actually are for change and improving that readiness, making inclusion processes more effective, so not just the policies, but actually implementation, and developing the shared values and motivations and looking at collaborations and partnerships and interventions that are actually sustainable. So we want to build on good practice that already exists, but we also want to look at extending that, spreading it and building on it. So combining research with the needs of policymakers and practitioners and looking at this across a range of different sectors. One of the projects that we've developed so far and are close to actually submitting is a research project on whether BME staff networks could be strengthened to support organisations that are managing the COVID-19 pandemic in order to reduce inequities of the pandemic on BME staff and populations. And what we're hoping to do in that project is to develop a set of criteria for BME staff networks so that they can effectively support COVID-19 policy making. And we've got various sites. I know that some of the people involved in this project are here today. We've got, for example, Leeds CCG, we've got Mid Yorkshire Trust, we've got the civil service partners as well involved in that, and Black Thrive is also involved in this project. And what we're hoping to do is to develop this set of criteria, and then within the research sites to develop co-produced action plans on how the existing networks can actually meet that criteria in full and become more effective than they already might be. And then we're working with the NHS Confederation, and we've agreed with leads within the Confederation that 6 trusts from the Confederation will actually join the project and use the criteria that we develop to identify any associations between how the BME staff networks works in that organisation and what indicators they might have, whether there's any associations between the level of effectiveness of the network and indicators on the workforce race equality standard and COVID-19 outcomes. And so we're looking at big data big data there to sort of measure this and see whether this criteria could actually be linked to other types of outcomes, because we know the workforce race equality standards are linked to more general issues like satisfaction with services and whether people would actually recommend the service to others, so the friends and family test, for example. And what we hope to do is disseminate good practice examples of organisational engagement with these networks and aim to reduce through them to actually increase their potential to reduce the higher risks of morbidity and mortality to BME staff and communities. And the research methods that we're using are various methods that again have been developed through and focused on through these workshops. So case study approaches, but also using participatory methods, which a number of people have mentioned, and then looking at the big data that's already there, routine data that is collected that we could then use to actually take these issues forward. We want to increase capacity within the organisations that we work with, so we'll be training peer researchers, members of the BME staff networks, to actually gather data either from their own organisation or from amongst the research sites, and to develop ownership of the research and of the negotiated actions within each organisation. We want to look at issues that have been raised before, such as representation, career progression, experiences of discrimination, and these are all aspects of the workforce race equality standards. And we want to look at population level data on morbidity and mortality from COVID-19 within the local populations that are served by these organisations. So in terms of other areas for research that are less well developed, a number of participants at previous workshops have talked about equality impact assessments and how these can be a lever for change if they're done well. So the idea of using legal, the policies and the legislation that's already there as a lever. Also looking at economic development strategies as levers for action, and there are some calls for proposals that might support that. People have mentioned a multi-sector whole system approach where there's attention to restructuring services in a more radical way, and the idea of evaluating the implementation of that, or actually looking at how that's being done across different sites so that sites can learn from each other, is another idea that has come up. Again, involving excluded groups in decision making, which has been the focus of today's workshop, looking at issues like co-production, representation in policy making, and then looking at place-based approaches as well. What are the links? What's the alignment between community level initiatives, institutional and policy level initiatives, and how do those things kind of support each other, or maybe they're actually working at odds with each other, and can we do more to actually bring them more into alignment? Then looking at the use of routine data, as I've mentioned, and innovative types of data that we might be able to gather, and matching action to current evidence, so identifying what's actually happening in practice to what we know are the best practice approaches so far, and trying to identify the policy and practice gaps that might exist. So we're really interested in involving people particularly from policy and practice settings in developing these ideas for further research in particular. And what we'd really like people to do is to think about whether this would resonate with your own organisations, with what you're planning to do in your localities, and whether you think that the Partnership for Social Justice can actually support what you're doing from a research perspective. So we really would like people to join, to get in touch with us about this. There's an opportunity today. One of the breakout sessions will be about trying to think about further areas of research and how we might take this forward, and also partners who are involved in the existing project that we've put together on BME networks are also welcome to join that, so that we can talk about that in more detail. You can see my email, and Morgan is also the research coordinator on this project. She's put a link up, I think, or she's going to put a link up to the breakout room today. So if you'd like to join that, please follow that link. You also have a chance to join more general discussions. So in terms of the breakout sessions after the break, you have a choice to either join the breakout room for future research proposals, which means you would log out of this meeting and use the Teams link that Morgan has put up in the chat. In that case, you join that meeting after the break, and then we'd put another link up so you can log back into this meeting for the feedback at 12:30. Or you have the choice to join a more general discussion on participation and the influence of excluded groups in service development, based on the sort of presentations we've had today again. And that will happen in a few minutes. So that will happen, I think, after the break maybe. So there'll be random allocation to a room after the break. So if you don't want to join the general discussion, then please use the Teams link in between. And if you do, then stay in this room and you'll be randomly allocated. And if at any point you get lost, then just press the help button on the Zoom toolbar at the bottom of the screen. And I just want to ask Victoria if she wants to add anything to that in case I've missed anything.
Hi, no, that's great, Ghazala. I think that's really clear. Just a reminder that if you are going to join the Teams alternative breakout, then please exit Zoom, but please remember to come back for the final session as well. Thank you very much.
Okay, thanks, Ghazala. That was really helpful and very clear. And just in case anybody needs to leave us now, I'd just like to have a sort of virtual round of applause and thanks to the four speakers, and also to Ghazala for really interesting presentations in this session. And see you at about 10 to 12 in the small groups. Thanks, everybody.
How can the community make a real change? And Sharon kindly posed this question. I think one of the participants mentioned the importance of giving, the communities giving time and energy and investing all this energy, and the importance of being relational. How can you give back that time and energy to the community? The other question was about building blocks in relation to the people that experience discrimination. And again, the importance of one of the participants who mentioned that working in the ground and talking to people, making sure that what people are saying, learning about their experience and listening to their voices, it's one of the important things that was mentioned. Also, another question was how we can make sure that what the organizations are doing and the community is taken on board by these organizations. And basically, well, it's been a long time over the last 12 years, some of the participants mentioned, then still things haven't changed. But it's important to bring the perspective of voices of color into the room. And one of the last questions was, what helps and hinders the influence of clients and communities? And again, the importance of service design, the importance of service delivery, and the importance of service evaluation. And this will be to know how the initiative from the organization have worked, and we can make sure that this have been given back to the community.
Okay, thanks, Nazmi. Does anybody who was in that group, Dio or Susanna, do you want to add anything to that? Or Sinead, do you want to come in at all? Susanna, you?
No, I think that was a good summary.
Okay, fine. Okay, let's move on then now to the next group, which was Vicky and Zoe. Zoe, are you here to give a bit of feedback?
Hi there. Yeah, we had some really interesting discussions in our group. I'll give some feedback, but Sanjeev and Camille, please do step in if there's anything that I miss or misrepresent. So basically we talked about sort of the challenges of, well, actually the benefits of using informal spaces during COVID, during the pandemic, and speaking to communities whose voices aren't usually heard. So in particular, one of our members brought up religious groups. And with Southwark having the largest number of Black majority churches outside of Africa, these are groups that usually aren't represented in organisations that are usually contacted. And then sexuality is also not considered very much, and much of the work is focused on socioeconomic status. And we sort of lose sight of the other intersectional identities that impact inequalities in health. And then in terms of talking about sustaining long-term relationships, we talked about wanting to avoid that tokenistic approach when you co-produce something, and about how to maintain relationships afterwards. And one of our members spoke about listening exercises that they've done before in the past, which have fed back to participants, made recommendations to council, looked into further engagement to look at these issues more closely, and sort of testing solutions with those who had engaged previously. So that was just, all those things were sort of seen as quite important to avoid tokenism, and also the importance of reciprocating with the communities that you sort of collect these stories from, making sure you're always giving something back to them, whether that be reimbursements through payment or providing training, you know, whatever it is that the participants tell you is most useful to them. And then we had an interesting conversation about the things that sort of hamper transformation in services and provision. And one of these things being people not being aware of opportunities to engage. And that it's often the case that certain people, certain personalities will be the ones to engage, and we're missing out on people who wouldn't naturally be inclined to get in touch. And how do you get in touch? How do you engage those people? And we had an interesting chat from a member from JRF, whose work is around amplifying the voices of those with lived experience, and sort of points around what organisations need to do internally to challenge what they mean about participation and engagement. So is it that they're leading the change, or is it that they're just story gathering? And to look at different avenues for engagement, what groundwork, connections and listening are you doing in the communities? And is this done in a genuine way that isn't about immediately imposing solutions, but you have to take into account the sort of time frames and the modes of the projects that you're using. Sorry, I'll try to speed up. And okay, there was an interesting part of discussion about sort of reimbursement, and making sure that when you reimburse people for their time and sharing their stories, that it doesn't have a negative impact on their welfare, depending on so, and one way to get around this is to ask participants directly how they like to be reimbursed. And sometimes participants ask for shopping vouchers, like for Asda or something like that, or sometimes they actually would like to attend lectures and training at universities. And yeah, I think the key point is to just make sure you're asking what's the most appropriate for them. And then the last thing, which was brought up, but we didn't really have any solutions to, so might be good to hear what the wider group thinks, is about how to continue engagement during this pandemic. especially with communities who are disproportionately affected, so it's Black and ethnic minority communities.
Great. Okay, thank you. Really, I mean, really nice, from sort of quite broad, challenging issues to some really practical steps that people can take. So that's really helpful. We'll move on, and then maybe we'll come back to some of the issues in a more general discussion. I'd just like to give all of the groups a chance to share their thoughts. So the next on my list is Charlotte and Karen. Is Karen here to give a quick feedback? Thanks, Karen.
Yes. Hi. Well, I think quite a few of the things that we talked about have been covered by Zoe already. So there was a lot of talk about tokenism that led into sort of legacy and sustainability. So some of those things I'll just leave because they have been covered already. But I think one of the main things that came out of ours was the idea around reciprocity. Sorry, don't know why I can't see that. And people talking about what went well in their research is often when they went off track to what they were supposed to be doing. So the research followed a track that was instigated and asked for and wanted by the community that they were studying themselves, not necessarily what they went into there to do or something that was described previously as what they were going to address, but that you know, reciprocity agreements could be built in by either if it's in research, the building in the flexibility to do research on what the community wants based on things that have come out from that, or if it's you know, in procurement or something like that, allow the managers the freedom to do that, to be able to really meet some of the things that they are wanting, that isn't something that we might have gone in there necessarily to do in the first place. Some other points raised, a great one was, we talked a lot about co-production. I know Zoe's mentioned it, so I won't go into it too much because we've talked about a lot of the same issues. But one of the points that's like quite an interesting one to just use is not always going in and asking what's wrong in a community, asking what works, asking, not always putting a negative slant on it, saying what's working in the community and what do you value within the community, because that's just as important to maintain and to keep going as to try and, you know, we talked about the perils of going in and trying to fix something, and that's not really what we should be doing. Another very interesting point was around you know, research for a community doesn't always and shouldn't always just be on that community. It should be focusing on what that community is saying they want to know about, or something that they want help with, or something they want to investigate further. So there was a lot of talk around sort of the influencers, the actors who can make decisions and make the changes, and if the community wants to know about them, a lot of the time we act on the behalf of those people that make changes to try and find out about the community, but actually what's needed is, well, again, I guess it's reciprocity as well, of what can be people that can bring about those change, and the community want to know what that is, because they, you know, you can't fully engage unless you know what's kind of possible in a way. I think most other things have been mentioned. I don't know whether Charlotte, whether you've got any notes.
I think that's great for now. If anything else comes up, we can add it in a minute, because and hopefully we can also pull these notes together and share them. I think what's coming across for me is that actually, you know, this is a very well-informed group, you know, with lots of experience and lots of things to share. So it'd be really important to gather them together. It's sort of raising questions in my mind, and I think this is partly the reason why Ghazala wanted to pull this network together, is, you know, this sort of questions about kind of ripple and having more systemic effects. It feels a bit like there's lots of pockets of good activity and insight and, you know, understandings of how these things should be done well, but whether it's, you know, kind of combining to have more of a systemic impact, I think is something we perhaps need to be thinking about more going forward. We've got two more groups, Amy and Christy Garner. Would you like to give feedback, Christy?
Yeah, sure. So we had some really good discussions as well, and we started off by talking about who are the core power holders and how do they need to act differently. So in particular, commissioners are the ones that hold a lot of the power and obviously the money, and they should be consulting with people who are delivering services and using services. And we spoke about how it's really confusing to know who to talk to and who are these commissioners. There's often multiple levels from managers, and then there's officers, and then this is different again in public health. So it can be really confusing to know who to go to, which was an interesting point in terms of really kind of tackling the people that should be listening and can start to change the system. Debbie gave a really good example of one of the things that's driving this and the way that commissioners are delivering services or is from NHS England. So obviously they have requirements and the CCGs need to meet these performance targets. So it's often this odd way round of doing things where there's targets that aren't necessarily or at all community led or driven that are then driving the way that services are commissioned. Obviously budgets have an impact here, I guess practically and realistically, how we can enable sort of resources and is there the ability and willingness to consult with communities. A really interesting point was how we measure this, and there's often a fixation with commissioners on wanting quantitative measurements rather than looking at self-reported well-being or listening to people's stories and having a different understanding. But Kat said that she had some good success with auditors and people in finance actually accepting qualitative measures and outcomes. So that was quite an interesting example of how things can start to shift. I think a lot of things have already been said in terms of, there's not a one size fits all approach. It's really important to listen to stories and making sure that it's not tokenistic. Often commissioners are going into communities, but they already have a predetermined sense of what they want to do and how services should be run. So it's very top down, and obviously that means that community members are not ever going to be truly listened to. And there's this issue around framing issues in the community or people as problems rather than a genuine effort to understand what's going on for people and how can we truly help and support. And the point was made that more co-design is really needed to really devolve this and try and make some impact from the start. I think the last point that was really interesting was about safe spaces and the use of informal spaces for engaging and talking to people where they feel comfortable. And Sharon gave some really nice story at the end about the advocacy work that she does and the conversations where that she's had with families which have been informal, but they have then informed formal meetings about how care is delivered, and these have been really empowering. And she says, sometimes we don't really even realise how marginalised people really are. We're inviting them to these meetings, but do they really have a voice? Do they really feel safe to input? And the qualities of a safe space. So that are going back to the core of really listening to people, not judging. And this actually might start to then change the way that people feel empowered in the community to be part of change. So, if people on the ground are starting to listen to me, then maybe others will too. I think that's probably, I have taken other. We had some really good discussion, and James gave some really nice feedback as well from his work that he's doing with ex-offenders, and there's not really sort of one place, and it's very disjointed. But yeah, that was us.
Thanks, Christy. Excellent feedback. I can see that Ghazala's wanting to speak, but I'm just going to ask Natalie to give the final feedback from her group with Sue, and then Ghazala can come in after that, if that's okay.
Yeah, great. So we also had some really, really interesting discussions in our group. I'm going to do my best to try and summarise them all concisely. We started off by talking about the importance of hope and not giving up, and the importance of forums such as this for fostering connections between people who are working in similar areas and who have similar aims. We said that often people don't know what's happening, so it's really important that you can share what's going on in a meaningful way and have that sort of communicative space. We talked about the opportunities that virtual kind of forums like webinars had created for people connecting across the globe in terms of broad identities around race, disability, for instance, but also that it's important not to lose sight of place-based work and the sort of importance of community action that's really located in a place or area. We spoke about the need to change the language that we use often when we're talking about these issues. So the term inclusion is problematic, we felt, because it sort of frames services or resources as if they're sort of possessed by someone or controlled by people, and that someone has to sort of grant permission or not permission for people to access those. And so there's a sort of power imbalance there right from the get-go, that we didn't have any solutions as to what to use as an alternative, but we sort of thought it was worth highlighting that in itself. We spoke about the importance of researchers or practitioners not going in with their own agenda, and I think that's similar to a lot of the points that have been pulled out of other groups, but actually sitting down with people and connecting on a human level, having discussions about the issues that are important to communities. We talked about the fact that evidence-based practice and policy can actually be part of the problem and reinforce racism, because people aren't always included in the evidence that we're using to make those decisions. It's not that we thought it was wrong to use evidence, but that at the moment evidence was really kind of patchy and holy in terms of applying across different groups. And we thought it was really interesting that a lot of the sort of reflections that have been shared today were about people having moved out of statutory services or kind of established services to work in different ways to try and address the problem. And we were speaking about the ways that there's kind of been an increasing restriction on professionals over time in terms of how much freedom they have to work in the way that they want to work with communities. So people felt like that was sort of getting worse a little bit over time, and people couldn't even, so not just health services, but teachers, for instance, couldn't always teach in the ways that they wanted to teach or teach about the things they wanted to teach. And that was really important at sort of establishing those values and kind of that empathy that we all need very early on. And we talked about the fact that actually systems often already include lots of diverse voices and identities. And so it's about also kind of how do we make sure that people in those organisations or systems are kind of given permission to speak their truth as well, and have those kind of honest conversations and create space for that to happen. So I think those are the main points that I've taken down, but if anyone from our group wants to chip in, I may well have missed things.
Thanks. I just want to say thank you to everyone who gave feedback for focusing on the different things and adding to the, that was really great, sort of rather than repeating the same things. So I think, together we've got a wealth of insights there. Thank you very much indeed. Ghazala, would you like to come in?
Oh yeah, please. I just thought it'd be helpful to feedback from our group as well, because we were talking about a whole system approach which is a place-based approach to addressing inequities. And I thought it might, if it resonates with other people, they might want to get in touch if they're interested in collaborating on this. So this was the idea of realigning services, and this is happening in a few places around the country where the issue of inequities is being seen as something that needs to kind of be used to restructure services and to work across different sectors. So we discussed the fact that actually now is an ideal time to focus on this. It's a really high kind of a profile issue at the moment. So really now is the time to look at these this kind of work across sectors and restructuring if it's possible at all. Politics is a key issue, both in terms of the fact that can happen now, but also in terms of influencing what happens. And we talked about the fact that the leadership might be willing to sort of look at this and to think about these issues, but it's very difficult for people within those services to not just carry on doing what they've normally done, and to actually have a clear vision for where they want to be. And in terms of involving people who are from excluded groups, actually using approaches that do give them real power. Again, the politics would come into that, and how can it be made, how can we ensure that they're actually given real power to influence change, and not just given a role that then is not actually influencing strategies at all. So we talked about the role of voluntary sector organisations, how it's really important to give them, to share power with them, the advocacy organisations, to redress in the short term, to kind of redress the fact that higher up in organisations, you can get very homogenous groups who are not representing the people who are excluded from those services. So in the short term, it's really important to bring people in, to give them power, and the actual ways in which to do that is something that research could perhaps help with in terms of facilitating that process and feeding in the evidence that's already there about how that could work. We thought something like a systematic review of the whole systems approach. Where has this been tried? It might not be in the area of inequities, but it could be obesity was mentioned as one area in which it's been tried in one place. And what can we learn from that? So issues around language, using common language across different sectors. And using implementation science frameworks. So research could play a role in actually feeding in those frameworks and those ways of understanding that could help with developing a vision. And so what we'd really like, and the other thing that we mentioned was that in areas where there's not much of a diverse community in terms of ethnicity. So one person in our group came from an area where there was a very small BME population, but actually the racism experience there was extremely high. And it can be worse in those areas. So actually learning about the lived experience and the emotional knowledge that actually can pass on can be really eye-opening for people in positions of leadership. And the mental models, changing the mental models that are already being used, as the Black Thrive leader mentioned, the Black Thrive speaker mentioned. So what we'd really like to hear from is anybody who's thinking about these whole system approaches or place-based approaches, and would like to sort of work on this idea of trying to look at the evidence that's already there on how to go about doing, reorganizing, realigning whole systems, and how to sort of work with us on actually supporting that process. We'd really like to hear from you. Thank you.
Great. Thanks, Ghazala. We just got about 5 minutes left now. I just want to open it up to anybody who hasn't had a chance to speak. If you want to raise your hand, if there's anything you'd like to say. And also, I guess, just in case any of our speakers, I think Amy, Leila and Jason are still with us. I think Ollie may have had to leave. But if there's anything you wanted to come back on, or anything particularly that you think we should be taking forward from the discussions, could you just raise your hand if anybody at all who'd like to have the last word, really.
Sarah, can I come in, Sarah?
Of course, Jason, please do.
Yeah, I think for me, it's just about capturing some of the discussions from today's event. So whether that's going to be shared out amongst participants, whether there's like an email chain that we can all share our emails with, and just to connect with people in the wider group, really. So yeah, because I've really enjoyed today. It's been a really good event, actually. So thanks.
Great, thanks for that. Yes, we'll compile the various notes and the presentations and share that. And perhaps Victoria can check with people about sharing emails. Is that Ken? Are you trying to come in?
Yeah. Are you hearing me? Yeah. Are you hearing me? Oh.
Yes, it's good. Go ahead.
Okay. Yes. One of the things that I was picking up on and trying to get into is the trying to connect from just listening, because I think in all of this experience is that we are very good at listening, but converting that listening into the action is really the important barrier we need, and we need real tools and skills to do so. And what I find the problem is in that transference is that the thinking that is listening is the same thinking that is bringing the new experience into the old way of doing things. So although we're hearing new things, we still are implementing what our mind is fixed in that old way of doing it. And it's trying to get that disconnect, for me, is the most important tool right now to convert those listening experiences.
Great, thank you for that. I mean, I think that does connect a bit to some of the discussions around the need to really shift mental models and framings and sort of fundamental understandings that people in positions of power have. I was also makes me think about, you know, models where you actually bring members of the public or, you know, service users, clients into, you know, not just the consultation side of things, but actually to the co-production and delivery of services. I guess one of the challenges with that is, does it then become, you know, are those people appropriately reimbursed and so on, or does it become a way of reducing costs? You know, that kind of concerns around, you know, people in voluntary roles or lower paid roles and so on. So, but I think the point is very well made, Ken, to move beyond the listening to the action that is going into a you know, a radical new direction. So that's I think that's probably a very good point to end on, unless I'm just scanning the list of participants if anybody else has got their hand up. I can't see any hands. I think we've done a lot of work this morning. I'm sure people are quite tired with all the information that's being shared. It's been quite full on. Just want to thank everybody once again, to the speakers, Leila, Ollie, Amy, and Jason, and also to Ghazala, of course, who has initiated the whole the partnerships for social justice, and all the people who did the facilitation, thanks for stepping in. That was great. And also, of course, to Vicky and Victoria, University of Newcastle, for their support to the event. So unless I've forgotten anything, just say thank you to all the participants. I've certainly learned a great deal today, and really enjoyed the workshop. So thanks very much, and hope to see you all again soon.